Hi, this is Kent Kingsley with My Medigap Consultant. Thank you for continuing to watch the video series on your transition into Medicare. Today I want to cover a very important topic where I want to go over the differences between a Medicare supplement and a Medicare Advantage plan. Many a times I'm talking with people and they tell me they have a supplement and only to find out they have a Medicare Advantage plan, and vice versa. So I want to clarify those two types of products and make sure you understand exactly which one's going to work best for you. So let's take a look at it and we'll get right into it. Thanks. Alright, so if you remember from the prior video that we did, we ended that with the two different ways for you to cover the gaps in Medicare. And we talked about pairing your original Medicare Part A and B with a Medigap or a Medicare supplement plan. And if you go that route, then you also have a Part D prescription drug plan with it. This fills in the gaps of Part A and B, and this gives you the most comprehensive coverage that is available. A Medicare Advantage plan replaces your Part A and B, and now it's managed by an insurance company. So let's look a little bit further into those two types of products. All right, so with a Medicare supplement plan, again, it's referred to as a Medigap plan. Medigap plans fill in the gaps of what is not covered by original Medicare, your Part A and B. These plans offer protection above what original Medicare does, because Medicare, unlike what a lot of people think, does not cover everything. So sometimes I've talked to people and they think that they get on Medicare and they have 100% coverage. That is not true. You have a lot of out-of-pocket exposure, as you saw on the last video regarding Medicare. Medigap plans do not come with prescription drug coverage. So when you purchase a Medigap plan to have prescription drugs covered, you will need to purchase a Part D drug plan. So now let's look a little bit about the Medicare Advantage plans. They're also called Part C or Medicare Advantage plans. Those two terms are interchangeable. Medicare Advantage plans replaces your Part A and B and then is administered through a Medicare Advantage plan. So essentially you're assigning your Part A and B, your original Medicare, you're assigning those benefits to an insurance carrier who, under a Medicare Advantage plan, they must cover at least what is covered by Medicare. In most cases, your Part D drug plan is built into a Medicare Advantage plan, so it's in one package. So you've got your replacement of your A and B that covers your doctors and hospitals on the Medicare Advantage plan, and they also, most of them will also cover your Part D drug plans. Okay, now that we've covered the basic differences between a Medicare supplement versus a Medicare Advantage plan, let's really dive down into those differences a little bit more in depth here. On this slide, I'm going to compare a Medicare Supplement Plan F to a typical Medicare Advantage plan, and we'll see what the differences are. With Medicare Supplement plans, I like to explain them, especially a Plan F, in terms of a buffet. You pay a set price to go when you go out to eat at a buffet. Let's say it's $10, and when you go to that buffet, you can eat anything and everything that you want to. Everything is covered under that $10 admission that you pay to get into the buffet. So you can eat as much as you want or as little as you want. It's still only going to cost you $10. And that's sort of how a Medicare Supplement Plan F works, in that you've got your monthly premium. Plan F has no copays or deductibles. It has 100% medical coverage. As long as it's approved by Medicare, then Plan F will cover 100% of what is charged. So you have no more out-of-pocket exposure with Plan F. So it's a similar principle in terms of going to the buffet. You pay your cost of the buffet or your premium for your supplement, And as long as you pay that premium, you can eat whatever you want to, or you can have whatever procedures you need done. As long as it's approved by Medicare, then it's covered under your Medicare supplement. A very important thing to consider when you're purchasing Medicare supplement or a Medicare Advantage plan is that with a Medicare supplement, remember, you still have original Medicare A and B. That is your insurance. The supplement just covers the gaps of what Medicare does not cover. So your insurance is Medicare. So you do not have any networks with Medicare. Medicare is your network. So as long as the doctors and hospitals accept Medicare, they accept your supplement. So you can go to any doctor in the country with your Medicare supplement and original Medicare. As long as they accept Medicare, you will still be covered. And in this case with Plan F, you would be covered 100% because there's no out-of-pocket exposure for your medical and hospital charges. With a Medicare supplement plan, it does not cover prescription drugs, so you will need to purchase a separate Part D drug plan to cover your prescriptions. If you recall, in a prior video, we went over standardization, and all plans are standardized, so Plan F is Plan F. They all cover the basic benefits. And with Plan F, as I said earlier, it covers 100% of what Medicare does not on Medicare-approved expenses. So the benefits are going to stay the same every year. You know, if Medicare changes deductibles or co-insurances within their Part A and B, it doesn't matter because the supplement's still going to cover that because the supplement's not changing. It still covers at the 100%. Medicare supplements are also guaranteed renewable. This means that every year your plan is going to renew automatically regardless of your health issues. So they cannot cancel your coverage based on prior year's claims or multi-years worth of claims. As long as you continue to pay your premium, your supplement will renew every year. You can change plans at any time with a Medicare supplement. Once you're outside of your initial enrollment period for Medicare supplements, which is the first month that your Part B goes into effect, which is usually your 65th birth month, but if you delayed Part B and started it later, the first month that Part B goes into effect and the next 5 months is your initial election period for a Medicare supplement. So that 6-month window, you can choose any supplement that you want from any carrier without answering health questions. So if you're on a plan and you wanted to change that plan after that 6-month period, you can do it as many times as you want to during the year. You just have to answer health questions. And typically it's going to be more of the major stuff: cancer, heart attack, strokes. So you want to consult an independent broker like myself just to make sure that you are able to change before you waste a lot of time in doing that. So with a Medicare Advantage plan, if I want to think of that as a cafeteria style, you know, I compared a supplement to a buffet. Medicare Advantage would be more like a cafeteria. So you pay very little to no premium to get into the cafeteria, but you pay as you go. So if you want a biscuit, you pay 50 cents. You want a stick of butter, it might be 10 cents. You want green beans, costs $1.50. You pay as you go, and you don't really know how much you're going to pay until you get to the checkout counter. And that's sort of how a Medicare Advantage plan works. You have low monthly premiums. Like I said, a lot of plans have no premium at all. Some of them might be $20. Some of them might be a little bit higher, but it just depends on your service area and what is available. You do have copays for doctors and hospitals, and again, those amounts are going to vary by carrier. Most plans are either an HMO or a PPO. So HMOs, if you're familiar with those, you have to use the doctors that are in the network of the HMO. You cannot go out of network and be covered. If you go out of network, then you're responsible for 100% of those charges. With a PPO, you get a little bit more leniency. You can choose out-of-network doctors, but you typically are going to have a much higher out-of-pocket exposure for those out-of-network claims. So with an HMO and a PPO, we've seen in-network claim or in-network out-of-pocket maximum up to $6,700 for 2017, and out-of-pocket exposure on a PPO for out-of-network as high as $10,000. So that's quite a big difference between the zero out-of-pocket exposure on a Plan F versus a Medicare Advantage plan where it could be as high as $10,000 for out-of-network or $6,700 for in-network. Most Medicare Advantage plans that you find are what's called an MAPD, Medicare Advantage Prescription Drug. So they do offer prescription drug coverage built into the plan, so you would not be purchasing a separate prescription drug plan. With the Medicare Advantage plans, they also can change those benefits every year. Remember when we were talking about supplements, they're standardized, so they cover everything that Medicare doesn't on the Plan F, regardless of what Medicare pays. With a Medicare Advantage plan, now your carrier is managing your A and B for you, and if they wanted to change copays from $15 to $40 the next year, they can do that, and they often do. So the out-of-pocket exposure that I'm showing you here may be higher or lower next year, and different copays in between the year. We've also seen, especially here in North Carolina recently, certain carriers pulling out of certain markets, different counties. I think one carrier pulled out of over 20 counties one year. So all those people that were in those counties and had been on the plan now had to move to a different Medicare Advantage plan the next year, make sure that their doctors were in the new network, and if they weren't, they either had to find a new doctor or continue to look at different Medicare Advantage plans that might be available in their area that their doctor would accept. So it can be a real hassle in that regards. Medicare Advantage plans you can only change one time during the year, and that's during your annual election period. It's called AEP. That's going to be between October 15th and December 7th. Any changes that you make during this time, if you change from one carrier to another during AEP, that new plan will go into effect January 1st of the next year. Now that we've looked at the general differences between Medicare Supplement Plan F and a Medicare Advantage plan, you've really got to ask yourself, which one are you most comfortable with? With a Medicare Supplement plan, it's going to be easy to budget. You're going to know exactly what your medical expenses are going to be, and you can use any doctor that you want to. But you're going to pay a little bit higher of a premium each month to have that choice. With a Medicare Advantage plan, you may be paying a little bit less each month, but you're not really going to know how much your medical expenses are going to be for that month or that year. It really depends on how you utilize it. And you also don't have the freedom of choosing the doctors that you want to choose with a Medicare Advantage plan. So again, a Medicare Advantage plan may work for a lot of people. It just really comes down to what you're most comfortable with, and just make sure that you understand the main differences between them. So what's the next step? Hopefully this video answered a lot of your questions between the differences between a Medicare Supplement versus a Medicare Advantage plan. If you do have any more questions, please don't hesitate to give me a call at 888-557-4812, or you can email me at kent@mymedicapconsultant.com. I'd be happy to go over any questions that you have, clarify anything that you might not have understood during this presentation, and I certainly hope and look forward to talking to you soon. Thanks, and have a wonderful day.